Imagine a newborn baby, fragile and fighting for life in hospital special care unit, only to be attacked by rats scurrying through the ward. This isn't a horror story from a movie. It's a real tragedy that unfolded in Indore, Madhya Pradesh, India's so-called cleanest city. Notably, in early September 2025, 2 infants died after being bitten by rats in the new natal intensive care unit at Maharaja Yashwantrao Hospital. This incident sparked outrage, with families blaming poor hygiene and rat infestation for the deaths. Doctors cited other health issues like heart problems and blood poisoning. But the bites worsened the baby's conditions. A probe was ordered, officials were suspended, and even political leaders like Rahul Gandhi slammed the government for failing to maintain basic cleanliness in public hospitals. This heartbreaking event highlights a bigger problem. Hygiene in India remains a silent killer, affecting everything from street food stalls to government services. Despite progress, lapses in cleanliness leads to disease, deaths, and daily struggles for millions. Let's break it down simply. The Indore hospital horror: what actually went wrong? In Indore's government-run hospital, rats bite 2 newborns in the NICU over the 2 days. The first baby, a boy with severe health complications, died on Tuesday, that is on September 2, 2025. The second, a girl on ventilator support, passed away the next day. The ward, meant to be sterile, was infested with rodents, a clear sign of neglected maintenance. Families reported seeing rats often, and the hospital "Clean City" tag felt like a cruel joke. Chief Minister Mohan Yadav ordered an investigation, suspending staff for negligence. Congress leader Rahul Gandhi called it outright murder due to government negligence, accusing the state government of failing in the basic duty. Doctors said both the infants were in a fragile condition, but rat bites worsened their health. Hospital staff admitted rats were spotted days earlier, but no complaint was lodged. Several staff have been suspended and a high-level probe is underway. Moreover, this isn't just about one hospital. It shows how poor hygiene in public health facilities can turn safe spaces into death traps, especially for vulnerable groups like infants. Recent similar incidents, not isolated cases. However, this Indore tragedy isn't alone. India has seen a spike in hygiene-related mishaps in 2024 to 2025, from hospitals to schools and events. Let us know about all of them in detail. Hospital fires and neglect. In November 2024, a fire at Jhansi Medical College in Uttar Pradesh killed 10 newborns due to faulty equipment and poor maintenance, a hygiene and safety failure. Food poisoning outbreaks. Over 1,000 outbreaks of acute diarrheal diseases, including food poisoning, were reported by December 2024, the highest since tracking began. Blame poor hygiene in food handling and water contamination. Notably, in June 2025, a temple feast in Madurai, Tamil Nadu, sickened over 80 people after eating contaminated food. School and hostel scares. In 2024, 42 food poisoning cases hit government residential schools, with bad weather and unhygienic kitchens to blame. In July 2025, a teenager died in Gujarat after food poisoning at a tribal school, leading to suspensions. Other public health lapses. Notably, in February 2025, 32 students in Telangana fell ill from school meals, and similar cases in Andhra and Bihar involved poisoned food. These show how hygiene slips in public spaces affect kids and communities. Shocking stats on India's hygiene gap. Data paints a grim picture but also shows improvement efforts. Sanitation excess. By 2024, 81% of Indians have basic sanitation, up from 40% in 2000, yet 19% still deficit in the open, mostly in rural areas. Water and hygiene. Only 74% of households have basic hygiene facilities like soap and water. Unsafe water causes 175,000 deaths yearly in Southeast Asia, with India bearing a big share. Health impact. Poor hygiene leads to 150 million foodborne illness annually in the region, costing India 6% of GDP in lost productivity and treatment. Diarrhea alone kills over 300,000 children under 5 each year. Urban versus rural divide. Urban areas have 93% sanitation coverage, but rural lags at 72%. Fly and mosquito infestations affect most homes, spreading disease like malaria. These numbers reveal progress under programs like Swachh Bharat Mission, which built over 100 million toilets and cut open defecation by 450 million since 2014. But challenges like poor quality toilets and cultural habits persist. That's all for now. Stay tuned to the Savera for more updates. Do like, comment and subscribe to the channel.